Most women miss their ovulation, and you know why? Simple reasons. The first reason is because most of them don't know the days they're ovulating, and the second reason is because most of them don't know the signs of ovulation. They don't know the major changes that happen in their body when they're ovulating. So if you're that kind of woman, you don't need to worry, because everything I'll be explaining in this video today is all about your ovulation. I'll be explaining the major signs that will show you're ovulating as a woman and what you should do to know if you're ovulating as a woman, because sometimes you might know these signs but you don't even know how to check yourself. You don't know the major things you can do to know if you're ovulating. I'll be explaining all of that in this video. So let's get started. Don't forget, if you're seeing my face for the first time, please do well to subscribe to my channel so you can get more amazing videos like this. And don't also forget to watch this video to the end so you can learn everything I have for you about this particular topic. And one of the major signs that will show you're ovulating as a woman is a change in body temperature. So as a woman, if you have been struggling to get pregnant, you have been struggling to know your ovulation days, and despite all your trials, you still don't know your ovulation days, then I will recommend you to always monitor your body temperature. Always check your body temperature. So if you notice a slight increase in your body temperature when you are not sick, then you should know you are ovulating, because temperature changes in the body when you are ovulating, because due to hormonal fluctuation. So the body temperature will change slightly, either 0.2 degrees Celsius to 0.5. If there's a slight increase of body temperature within this particular range, then you should know you're ovulating as a woman. And not just that, there are other changes that might also happen in your body accompanying this particular body temperature, which is cervical mucus. You must always monitor your cervical mucus, the mucus that comes from your V. You must always check it to notice if there's an increase in the production of this particular mucus. Now, during ovulation, the mucus becomes more slippery, more light, more thin, it becomes more stretchy. It becomes like egg white. You should know you're ovulating as a woman. But if you're that kind of person that don't even monitor your body at all, you might not know you're ovulating, because you might not notice this particular mucus in your V. The other sign that will happen in most women when they are ovulating is tenderness of breast, which means their breast will get swollen. It might get tender when they're ovulating. So as a woman, if you just notice a kind of slight increase in the size of your breast all of a sudden, then you should know you are ovulating as a woman. And there are other signs that might also happen to women when they're ovulating, and this other sign is discomfort in their pelvic floor. They might experience some kind of cramping on their abdomen, just mild cramping but not much. When the cramping becomes more severe, then it's another thing. But during your ovulation, there'll be a kind of mild cramping. Sometimes it might happen either at the left side or at the right side. It's normal. It happens like that when most women are ovulating, because they are releasing egg and there might be some kind of changes in their pelvic floor. So you might experience cramping when you're ovulating. Now, there are other signs you might experience in your cervix. Your cervix might change location, which means the cervix might protrude in, it can go inside, and it might become more tough, it might become more thick. So when you just insert your hand to your cervix, you might experience that the cervix have shift inside, or the cervix may become more thicker. But this happens to some women, not every woman. So you need to monitor all of this when you don't know when you're ovulating, so you can know the days you're ovulating for some women, because most women might not know they're ovulating due to the fact that they don't know all of these signs and symptoms I've just explained. Now, there is another sign we call emotional signs. Emotional and psychological signs. These are the signs you might not see, but you notice them in your body. You will notice them in your body. As a woman, you're the only person that will notice them. And one of the signs you will notice in your body when you're ovulating is a slight increase in your libido. So as a woman, you just need sex. You'll be wanting sex when you're ovulating, because there will be a kind of spark up in your sex drive. So you need to also monitor this. When you notice a kind of spark up in your sex drive as a woman, all of a sudden, then you should know you might be ovulating during these days. The other changes that might happen in a woman, the psychological changes and the emotional changes, is a kind of mood swing. As a woman, you might have anxiety, you might have mood swing, you might just be irritable, you don't want anybody to talk to you during your ovulation days, because there's a fluctuation in your body hormones, and this is entirely normal. So after watching all of this, please do well to practice any of the recommendations I've just given you in this video, and also monitor your body for all of the signs I've recommended for you in this particular video, so you can know when you're ovulating and when you are not ovulating, because most times calendar method might fail you. You might be having irregular menstrual cycle, and these signs I've just explained are the only signs that will show you ovulating. So after watching this video, if you enjoy it, please do well to subscribe to our channel so you can get more amazing videos like this, and don't also forget to share this video to as many people as you can. You might be saving the life of somebody. Thank you for watching this video. If you have questions you wish to ask about this particular topic, please do well to drop them in the comment section so I can respond to you as soon as possible. I'll see you next time.